All right, thank you very much, Robert and Megan, and thank you to everyone who are attending tonight. I hope that you're as excited as we are to hear from the communications team from the Middlesex-London Health Unit. The pandemic has been one of the biggest communication challenges for our time, and I'm sure that we've all felt that in the work that we do every day. But there are a few organizations in the City of London that have felt this challenge as acutely as the Middlesex-London Health Unit. This team has worked tirelessly across channels to help keep our community safe and informed. We are pleased to be joined tonight by three members of the team, Dan Flaherty, Beth Milne, and Alex Tyml. Dan Flaherty has been the communications manager at the Middlesex-London Health Unit for 16 years and is a founding member of the Ontario Association of Communicators in Public Health. Dan has an extensive background in communications, honed over a career that has spanned more than 2 decades. His previous roles include Senior Communications Officer with the Ontario Ministries of Tourism and Recreation and Culture, as well as Media and Communications Manager with the Canada Games. He also has a background in broadcast journalism and radio. Beth Milne has worked in various public health communication roles for the past 12 years at the Middlesex-London Health Unit. During the COVID-19 pandemic, Beth has navigated and implemented full-scope communication services across the organization with a focus on internal communication, virtual event facilitation, partner and external relations, communication strategy, media relations, and brand reputation and issues management. Beth earned her undergraduate honors degree in media information and technoculture from Western University and is embarking on graduate studies this fall as a student in McMaster's Master of Communications Management program. We are also welcome Alex Tyml, a digital communications specialist. Alex leads an online content and voice of Canada's largest independent public health agency. He has worked as a private health communicator for 10 years and has a passion for storytelling, social media engagement, creative design, and video production. He earned an undergraduate honors degree in media, information, and technoculture from Western University and a postgraduate certificate in corporate communications and public relations from Fanshawe College. So please join me in virtually welcoming Dan, Beth, and Alex. We're pleased to have them with us this evening.
Thank you so much, Jay, and thank you, Michelle and Robert and Megan as well. We are glad, honored to have been asked to be part of your AGM by the IABC London Board. This is a unique opportunity for us to be part of this evening and also to share a bit of our experience that is ongoing, even as we do this presentation tonight with you as we continue to navigate the challenges of the pandemic. I did want to just mention something quickly off the top, and that is that we're gonna go through a lot of material, and we're gonna try to save about 15 minutes at the end, being respectful of everybody's time for questions. I think I was trying to think earlier today of an illustration to sort of give you an idea what we're going to talk about versus how much we've been through. And the best I could come up with was tuna. And why you might say tuna? Well, we can all identify with a can of tuna. This is something very small, but the reality is that the tuna is a big fish. They get to be 8 feet long and they weigh more than 550 pounds. In some ways, the journey that we're going to take you on for the next little while is kind of like that can of tuna. It gives you a good idea what things taste like, but it doesn't give you the whole big picture. So before we dive right in, I'd like to give Beth and Alex, if they'd like, an opportunity just to say hello.
Hi, thanks so much for joining, or thanks for having us tonight. You know, really excited to kind of share some of the things we've been working on. You know, I love the tuna analogy, Dan, and I think that as we go through tonight's conversation, it will become kind of clear like how much we've gone through and how much you know, we've all experienced throughout this pandemic. And sometimes we joke on our team that a week feels like a year because of how much stuff happened. So looking forward to kind of sharing our experiences with you all today.
Thanks, Alex. I'll echo what Alex said this evening. Very pleased to be joining you all, and very excited to share some of our journey with you all this evening. It has been one, but I do believe there's many partners on the event this evening. I believe we've all been in it together. So looking forward to sharing our journey with you, thanking the many partners who have been with us along the way, looking forward to answering any questions. And I must say, it's fun to be on the other end of things this evening. Typically, we are running the live events, we're behind the scenes, we're planning the webinars. So it's a real treat tonight to be on the other end and presenting and sharing our story with you this evening. So thank you.
Thanks, Beth. Thanks, Alex. I'm going to, Beth alluded to the events that we put together. We typically run on MS Teams, so this is a little bit different. So if you'll be patient with us, we'll try to muddle through. So I'm going to share my screen, and I think that's going to minimize me on the on things. So hopefully, I think we can get that. Can everyone see that? Yes. All right. So let's talk a little bit about what we're going to talk about. Yes, MLHU's pandemic communications adventure. And I know we were talking earlier this week, and Robert and I were talking about MLHU, who became this sort of, it was kind of funny because we ended up having people ask us about who MLHU was and what role she played on the communications team. And it's the things we take for granted. And the reality was it was just our acronym that we all said like it rolls off the tongue. And as communicators, we know that sometimes what we say internally isn't always understood by all of our audiences. So that's what that was about. The outline, we're gonna go over a bit of a synopsis of where we found ourselves back at the beginning of 2020. 4 big topics: pivoting to face the challenges of the pandemic, leveraging existing relationships to enhance our efforts and to increase our reach, setting a tone that encourages the community and builds confidence, and finally, reaching out and supporting the effort. So, and we do have an opportunity for questions at the end. Well, let's talk about the beginning of the pandemic. We actually, COVID-19, it was named for the year in which it was identified, and that was 2019. It came to my attention, the first thing I saw was a PubMed post from New Year's Eve. So basically December 31st, 2019, that identified this unspecified pneumonia originating in China, in Wuhan. And from there, it was on our radar. And it was on the 31st of January of 2020 that we announced the first local case of COVID-19. It was in a student from Western University and became the 3rd case in the province of Ontario. And we, Dr. Mackey and I actually ended up taking a train to Toronto that morning to be part of the announcement from the Chief Medical Officer at the time, Dr. David Williams. And it was a rush. It's one of those things that you get to experience, I think, infrequently in your career as a communicator. And Beth was on the other end of the line all day. We were in constant contact about developments, about developing the message, and all the information that was coming in. The pace was unrelenting and very fast between not only us as members of the health unit, but also with Western University and with the Ministry of Health and the Office of the Chief Medical Officer of Health. It was probably the most stressful and in some ways shortest train ride that I've ever had to Toronto, because the ticket I was able to get and Dr. Mackey was able to get were in separate cars. So we were constantly getting up and walking back and forth. And the 2 people who were sharing the little 4-seater that I was in were very intrigued about what was going on, because I was trying to be as cryptic as I could. From there, we had all kinds of things happen. We started talking about physical distancing. If we think back to the beginning, and even now you hear about social distancing, we became very aware early on that the term social distancing was actually a challenge for some people, because social isolation was becoming an issue even in the early stages of the pandemic. So we were looking at how could we illustrate keeping that physical distancing, and the idea of a couch and a cow came up to sort of illustrate some of those things that we had. Where else did we go? Well, masking became a big thing. How to don a mask, how to doff a mask, how to store your mask, sanitizing your hands before and after, and then everything in between that came along. And when we were having conversations about the presentation and started seeing these graphics again, that in a lot of ways we had either moved on from, forgotten about, or purposely blocked from our memories. You'll remember the idea of social circles versus social gatherings. Who was in your bubble? Stay within your social circle as much as possible. Get tested if you were symptomatic. We think early on to the winter of 2020 and into the spring, the message was stay home. We had the stay-at-home order that came into effect even in early of 2021. We look back at things like the AstraZeneca vaccine and concerns that began to emerge about blood clots, and a lot of concern about the effectiveness of the vaccine and the risk associated with it. So we had developed communications collateral to put that into context, letting people know that they were eligible for the vaccine and getting those messages out. And finally, messages to build some confidence that you could do your part to help fight the pandemic. The team really has focused its efforts on sharing information about the pandemic, including guidance, and you saw some of that in those early graphics and even some later graphics that we've developed. We really also focused on advice and information, really helping people to understand what was going on with the pandemic, the things that they could do from a personal level and a community level to help limit the spread. We also wanted to talk about, obviously, increasing uptake of vaccines. So where are we now? Well, fast forward to the fall of 2021, and we have come a long way. This is a picture that was taken last week at our new pop-up vaccination clinic at White Oaks Mall. And we've had to adapt, and we've had to change things, and we've had to move around and come up with new strategies to figure out how to make it easier for people to get vaccinated. And this is one of the strategies that our teams have employed. Previously, we had a pop-up vaccination clinic at Masonville Place that also went very well. I'm happy to say that in the last few days, we've had more than 300 people a day come through the vaccination clinic at White Oaks Mall. This is actually outpacing our mass vaccination clinics right now. It's convenient for people. It is a place where they may have other things to do. And certainly when we had our clinic at Masonville Place to coincide with back to school shopping, it just made sense. And again, when you start to look at ideas about how do you get into the community, how do you communicate a message, how do you get out with something like vaccination, the idea of going to a mall and using an empty store wasn't first on the list, but it's proven very effective and successful. Again, just in the last week, about 2,000 doses delivered at White Oaks Mall, and about half of those were first doses. Certainly, the requirement for proof of vaccination has driven that to some extent, but again, just another strategy that we used along the way. So let's talk about, well, pivoting to face the challenge of the pandemic. Now, I mentioned right off the top that we reported our first case of COVID-19 in late January the 31st of 2020. We didn't have a second case until the 14th of March. So what does that tell us? Well, it tells us a few things. We were able to save it as part of our media messaging that our initial case did a great job in taking the steps necessary to reduce the risk and prevent further spread of COVID-19. We didn't see any cases for a month and a half. But even though we didn't have the cases, it was clear that for more than a month, even before that, the pandemic would carry with it some major communications challenges that would require a consistent approach and a strategy that considered not only media relations and public relations, as well as social media, but technology and community outreach. That was evident right from the very beginning. And, we had to look at those things and try to figure out, well, how do we focus the team's efforts on responding to the challenges of the pandemic. We needed to ramp up. We needed to really stop everything we were doing that wasn't related to the pandemic. We had to focus our efforts on responding to the challenges of the pandemic. It meant a big pivot from our work. You know, the health unit for the last 20 months almost has been about the pandemic, but we've got a lot of other things that we normally do, and we had to put all of that on hold. We also had to move from a 5-day-a-week operation to a 7-day-a-week operation. Because of the demands for information, we were going to have to reorganize and rethink our website and create a one-stop for COVID information. So Alex and working closely with other members of not only the communications team, but health unit staff, brought those resources together early on. We were able to use the resources available through one of the health unit's librarians and seconded that person to work with our team, Carolyn Gabriel. And Carolyn has done a marvelous job of curating information, but also staying up to date on the changes that come from the federal government and from the provincial government. Because in those early days of the pandemic, if you can think about this, when information changes in the matter of over a day or over a week, it requires you to be nimble. It requires you to change course and set direction. We were having days, and I'm kind of looking at Alex and Beth to remember back to those early days, when the direction and the guidance would change several times over the course of a day. And you would share messages and you would update content only to have to change it again shortly thereafter. And you know, it was an exciting time. It was very early on in the pandemic, and we really had to figure out how to adapt very quickly, how to move on from what we had just done, and in some cases leave that which we had just done behind. We really did a big effort of promoting and highlighting our general delivery email account so that questions could go there. But again, it was about paying attention not only to our internal needs from a communication standpoint, but what was coming to us from our partners at the provincial government, at the federal government, and also at the municipal government and other organizations in the community that we needed to share. So really working with those partners, both internal and external, and looking for specific expertise in-house was going to help us to reach that. So we talked about focusing the efforts. We talked about the website. One of the things we did, and here's a picture of Beth doing one of our virtual media briefings. We started doing virtual media briefings, and it was early on. We started April 6th, 2020, and we had 5-day-a-week media briefings pretty much into the beginning, well, end of July. It went to 3 days a week into the middle of August. And then we've been doing it twice a week since August of 2020. So including the virtual media briefing we did today, we're up to about 195 of these. And, you know, this has been a real opportunity to streamline our process, focus our efforts. If you can think about the challenges of responding to media requests that come in, obviously through the pandemic, our key spokespeople, Dr. Mackey, Dr. Summers, their time is extremely limited. Creating an opportunity for the media to have access to them, originally 5 days a week, then moving down to 2 days a week to ask questions related to the pandemic, really helped solidify the relationships with the media. They knew when a consistent time was going to be where they could speak to the key spokespeople. And as it turned out, unintended consequences and outcomes that work, the media started to carry these media briefings live. So we now find ourselves having access to a very wide audience, even beyond the media, through Rogers, through Global, through CTV and BCE as well, where our briefings are carried live Mondays and Thursdays, which is pretty awesome. We've also held virtual webinars for specific groups, which has been pretty good for us to reach those targeted audiences. We'd originally looked at ways that we could leverage technology that was in place through telephone polling and building lists of audiences that way. But between the cost and the resources required, it was just prohibitive. So our team, and I should sort of take a step back, we also have, in addition to Beth and Alex and myself, and I mentioned Carolyn Gabriel, we have Jason McAuliffe, who looks after marketing, and we also have a team that looks after the outreach to our healthcare providers across London and Middlesex County. And one of the public health nurses who works on that team, Lori Reese, was looking into ways that we could use Microsoft Teams in different ways. And, you know, even early on, she was able to figure out how we could use the platform that we use for our meetings and communicating to do these live events that eventually culminated into things like our virtual media briefings, where we could have large audiences join us for a presentation, that we could have multiple presenters in the background, we could have Q&A, we could have a separate chat, all of these things in real time and accessible to people. So we've had town halls for parents and guardians in schools. As we speak, there's another virtual media briefing going on right now with the London Chamber of Commerce. Beth, Alex, I mean, there are others that we have done as well. And I'm drawing a blank right now. If you guys can pull one in there.
For sure. Yeah, we've hosted a lot of different live events with many different audiences over the last, 18 months. London Middlesex Local Immigration Partnership, many of our partners, Cross Cultural Learner Center, LUSO Community Services. We've hosted them for food premise operators who have questions about new and changing guidance. And we've hosted them with the sport and recreation industry, with the Thames Valley District School Board, Catholic School Board, private schools. We title them at different times, you know, town halls, webinars, or live events. But really, it's a live Microsoft Teams event that we're able to share widely with a number of different members of the public or partners. And we've been able to reach a wide variety of both the public and stakeholders and partners through these events.
And I know that, Alex, you've got some content to share a little bit later as well about how we reach those audiences using the technology that we had available. I also wanted to talk about another key piece that we did, and that was our internal work with our own team. This was something, and I remember early on, because the other thing that happened, and I just thought about this today, in the middle of the beginning of the pandemic, we moved. Like, the entire health unit moved. The entire office that used to be at 50 King Street moved to our new location at City Plaza. So if you can imagine, you know, we came back from the holiday break in January to a new office space and needing to reconnect with our team. We used to meet on a daily basis. We now meet twice daily with the communications team and do some touchdowns. And I remember early on mentioning in a conversation that came up that what we were about to experience was the kind of thing that our children and grandchildren would learn about in the textbooks when they went to school, and that this was an opportunity, and to remember that sometimes as well. We really wanted to maintain the cohesiveness of the team, and that we all were working together as communications professionals toward a common goal as we navigated the pandemic. So we initiated the twice daily touchdowns from once daily, and once we moved to remote working and weren't all in the same place, again, Microsoft Teams came to be the platform through which we connected. It's not always easy to maintain that sense of collegiality, but I think we've been able to do it. In the slide here, you'll see ego cookies. These are the things that we can. I don't remember who exactly came up with it. It might have been Beth, where it was when we had moments where we really wanted to boost each other or boost a member of the team and say, way to go. You know, we would use the term ego cookies, and pretty quickly the gift filters and all those sorts of things. There's a lot on there about cookies. And also, as we discovered recently, sloths flying on slices of pizza. We can talk later if you have questions, but there's all sorts of things. Keeping the humor is really important. Internally, our staff also moved to weekly all-staff town halls using Microsoft Teams. That continues. Those are led by Dr. Mackey and Dr. Summers. So there's a connection with the entire staff of the health unit. And we also, during those town halls, there's an opportunity to recognize the contributions of individual staff members for their leadership, teamwork, and kindness toward others, which has also been a theme internally all the way through. The communications link between managers who oversee frontline staff has been key as well. And really, as I mentioned off the top, having the health unit's website as that one-stop place where you can get the information you need about the pandemic has been key. We have a hotline program right now, and again, they can go to the website, they can get the information they need to share with people who call in, which has been very, very important. I do want to talk about a little bit about, and I'm going to hand over to Beth here in a moment or so, but leveraging existing relationships. I wanted to touch on this a little bit more because one of the things that has been important to me, and you know, as we grow our team, as we work together and grow as colleagues, is the importance of relationship, not just amongst ourselves and our other colleagues in the health unit, but with the media, with our community partners, with our stakeholders. Having solid relationships with the people you're working with before a big challenge arises is going to help navigate the challenge that much more effectively. As Jay mentioned off the top, I have a background in radio broadcasting and broadcast journalism, and also my experience with the Canada Games. I have come to know most of the reporters and journalists in London and Middlesex County. You know, and it's beyond just knowing their name. We're able to have conversations. We can talk about all sorts of things, and I think that's been really important in being able to develop messages, to develop an understanding that while they can anticipate getting answers and getting spokespeople and getting comments on stories from us, there are times when we've needed to go to them to help get messages out as well. Whether that has to do with an outbreak that comes up pre-pandemic, or also during the pandemic where there has been a need to get information out. You know, we're going to touch on it at the end, I think, again, but it just makes me think about some of the challenges along the way when you make mistakes. We made a mistake in a media release where we had issued an announcement that vaccination eligibility was being expanded to children who would be turning 12 in 2021. And the text of the media release said this would apply to anyone who was born in 2009 or later. And it went through how many sets of eyes? 3, 4 at least, and nobody caught it until the release went out. And it was a reporter who contacted us and said, pretty sure you mean 2009 and earlier. So very quickly pivoting and getting the message out that yes, in fact, we made that mistake, we owned it, we fixed it, and there have been others as well. But having those relationships does allow things to go a little bit more smoothly, even when the news is challenging to share, or there are challenges that arise with what you can and can't say. And probably touch on that a little bit later. But it does allow us to increase the reach. We have also seen where we've had media stories go beyond the local to the national, whether it's with CTV News Network or CBC, Power and Politics, things like that, that we've been part of many times over the last several months. And things change. There's a whole lot that we need to get to, including this dashboard that, you know, we originally were putting out a media release every time that we had a case. And then it was when we had a death. And pretty soon it was clear that that was unsustainable. There was no way we were going to continue being able to do that. So working with our epidemiologists who were gathering this information anyway, working to create a way that members of the media, members of the public, anyone who wanted to know what the latest information was about the pandemic in London and Middlesex County, they could go there and they could find it. We had to adapt. We had to move in a way that we were more transparent and more available. It is all about relationship. I'd like to now hand it over to Beth Mill.
Thank you, Dan, and good evening, everyone. As Dan indicated, it is all about relationships. And early on in the pandemic, we realized that partnerships and relationship building were a very important part of our work, especially in the early days, working with Western to issue the first joint release about the case in London, to working with other public health agencies across the region, the province, our city and county partners, police, hospital, post-secondary, school board, primary care, and the business community. These were all relationships that we had previously established, but that we were able to reach out to these partners and build on in the face of this crisis. I actually just want to circle back to something Dan just said as well, because I was just reminded as well that relationships internally were also something that we called upon. And when Dan mentioned, the mistake that we made, something that we've started to do as a communications team and that we talk about doing and we really value from our relationships with colleagues within the organizations is running our work and our ideas by others in the organization, because we've written so many releases and we've written so much and we have our head so in the game all the time. Sometimes it's important to check our content or our tone or our information by other teams, or by, we're very fortunate to have some team members who just got back from parental leave who have a really different perspective on the pandemic and the guidance and the communication. And we so value those relationships as well. So I think from an internal communication point of view, relationships with our own staff across the organization, their perspective from anything from non-pandemic related items to how we're speaking to the general public to how we're communicating to cultural groups in the community as well is very valued. So aligning that work and our messaging with those of our partners and connecting with communications teams across the region to share information and support one another was really important. And also establishing and building relationships with new agencies and organizations has been an important part of our pandemic response as well. So as you can see here, this is a very old image at this point, but it was a really important time where we leveraged the relationships that we had with Thames Valley Family Health Team, LHSC, Middlesex-London Paramedic Service, and the City of London and the County of Middlesex as we started to work towards setting up assessment centers. I had the opportunity to attend the Oak Ridge Assessment Center for the first media walkthrough on March 17th, 2020. And, leveraging these existing relationships allowed us to collaborate with partners to try to bring more information to the public and to share information more widely. We were able to enhance our communication efforts and create opportunities for the media and the public to understand how things worked inside of these clinics. By bringing the media in to learn about the process and flow of these clinics, we were able to help them tell the story to the public and help the public understand what to expect if they needed to attend for a COVID-19 test or a COVID-19 vaccination. So it was really important to not only bring the media along, but give them as much information as we could to help them tell the story, to try to share it widely with the public. So the public knew what to expect and how to wayfind and how to navigate, and to not be scared that these services were here to help them and to help identify COVID in the community, but also in vaccination to help try to fight the battle against COVID-19. So we were really fortunate to have these existing partnerships as well. Something that was really important, though, when looking at leveraging existing relationships to enhance our communication efforts and increase our reach in the community, it also became very clear to us that there were many audiences in London and Middlesex that were not receiving our messages and guidance. So it became important very much in the middle of the first wave last year that we needed to look beyond our mainstream communication and our mainstream communication platforms to initiate conversations and build relationships with key community partners outside of our mainstream audiences. We wanted to dig deeper and build relationships and hear from partner agencies who served communities who weren't receiving our mainstream messages through Twitter or the website, and who faced challenges in accessing information and receiving those messages. So with a review of some social determinants of health data and some other regional data that helped us identify, some regions where we had identified higher numbers of COVID-19 case counts, and later on in our efforts where we had seen lower uptake of vaccination, we reached out and held consultations with partners who worked with community groups in those regions. Some of the partners, and we have a very extensive partner list now, but some of the partners we worked with early on that were such great partners in helping us to get our messages out were South London Neighbourhood Resource Centre, Cross Cultural Learner Centre, Luso Community Services, Muslim Resource Centre. We really wanted to talk to these agencies and learn about these communities and the challenges that they may face and the strategies that could be employed to help them overcome the challenges in accessing our information and learning about COVID-19. The conversations we had with these partners were really important to help us inform the next steps of our communication and our response. And we were really intentional about trying to approach the consultations from the position of not assuming that we knew anything about where these communities and these audiences were coming from. We really wanted to gain insight from the partners who had trusted relationships with these communities and cultural groups and who were experts in their particular area of work, working with these clients and constituents. And rather than kind of imposing a strategy or an idea that we thought might work in those communities, we kind of went a little bit backwards and we talked to them and we learned all about their communities and their audiences first. And we wanted to try to leverage the plans and the communication mechanisms that they already had in place and that were working with those communities, and that they had built, a trusted, regular, consistent way of communicating with those audiences. And we also wanted to talk to some of the key influencers in those communities where there may have been some different communication platforms that we weren't using, but they were using to connect with unique audiences, and also in ways that we hadn't really been able to share information, and the key in this being in other languages. So our goals ultimately from these conversations were to learn from these agencies and integrate their feedback into our work, to develop resources and support our partners in their work, and create a distribution list to continue to share guidance and resources throughout the pandemic. So as we expanded our communications through this partnership and as we continued conversations with these partners, we did gain a lot of insight, and it helped us really to add a layer to the work and the communications that we were developing for the general public. We learned that there are a lot of communication mechanisms that these agencies are using outside of, mainstream Twitter, Instagram, and website. Things such as WhatsApp and different types of virtual women's groups or youth events were held where settlement workers in schools or different types of staff at these community and neighborhood resource centers would talk to and support newcomers and cultural groups in different platforms and settings. We also learned that they were trusted members of these cultural communities, and that if we were able to share our information with these trusted members or these key influencers who already had established relationships with the communities and share it in the information in a language, the first language of these cultural communities, they might better be able to understand and might better be able to receive the information rather than us just sending it out in English on Twitter all the time, hoping that it reaches everyone, when we knew that just wasn't working. And one of the biggest barriers that we learned through our conversations with these partners were that a big barrier was not having access to information in other languages. So, the health unit had always made an effort to try to have information in French, but we didn't have a very vast portfolio in languages other than English and French. So we really, through our partner consultations, were able to identify some of the key languages for the communities that our partners work with, and develop some materials and also adapt some of our materials into language that was a little bit more sensitive to the communities that we were working with as well. So we were made aware of some of the sensitivities in language that could possibly be triggering for certain newcomer communities, especially communities that had been coming from countries where there was war. So I remember early on, we had a vaccine confidence postcard we had developed for long-term care home staff, and there was a term in it that was a bit of a war term, and I can't think of it off the top of my head. I think trigger or something like that, but we looked at that and we changed the language before we had that translated so that it would be better received by the communities who were reading it. We also wanted to talk to these communities about what the people in their client groups needed as well. You know, what we thought the clients might need turned out not to be what they needed at all. They needed to, you know, have some infographics and hear some, you know, myths and facts and dispel some of the myths they may have heard about COVID-19 or about the vaccine. We also asked them, you know, what are your clients asking for? And many had trouble navigating the vaccine booking system. So we created in 6 different languages resource, and that's what Dan has up on the screen here, a resource that helps walk through the vaccine appointment booking system, also making it very clear that a health card isn't required and clarifying some of the concerns that these groups might have. And we were in constant communication with these partners to get feedback on materials and update and change them, and also try to update the materials in a way that would be appropriate for all of the communities as well. We were also able to, as we indicated earlier, organize a series of webinars and information sessions where these communities got to access and ask questions to some public health nurses that work at our organization, and also Dr. Mackey and Dr. Summers. So they were able to have a live Q&A session through London Middlesex Local Immigration Partnerships webinar and try to ask some of their questions and talk through some of their hesitancies around the COVID-19 vaccine. So this work truly has been transformational, not only for the amount of information we're able to provide to all of the communities that we represent here in Middlesex, London, but also adding to our multilingual webpage on the website, and also establishing relationships with new agencies and partners and organizations that we really hope to continue to work with beyond the COVID-19 pandemic. And that's been a really big takeaway for us, is that above and beyond communicating about COVID-19 and the vaccine, we will continue to be able to share important public health messages with these communities through this relationship development as well.
A lot about relationships, but once we got those together, one of the other things we had to do really was talk about tone and figuring out how to tell those stories, how to share those messages. So I'm going to hand things over now to Alex, who's going to take us on a journey on the third topic of our presentation, setting a tone that encourages the community and builds confidence. Alex?
Yeah, and I just want to start off, like, it's just been such an honor to work with Beth and Dan throughout this pandemic, and just listening to you talk, it just brings me back to how closely we've worked together and how we've supported each other. And I feel like that's kind of a good segue into social media a little bit, because you know, MLHU's, social media efforts are really to support and expand, the MLHU's ability to communicate important messages, and also to reach audiences that might not consume traditional media. Students and parents might not be tuning into the twice per week media briefings or watching the 6 o'clock news. They might not even have cable TV. So social media has kind of become a very interesting part of our communications efforts at MLHU, because we were able to kind of tap into the public and what they're thinking, what they're feeling, what they're experiencing. And that has allowed us to kind of build a community and build a space where people can go for trusted information. And when I read the topic back to myself, setting a tone that encourages community and builds confidence, before the pandemic, MLHU did have a pretty good social media presence, but we've been able to expand our audiences greatly over the past 2 years. And we're at a point now where, there's been a point where, there was a low number of people who showed up to a vaccination clinic, and I've received a notice from one of our team members that, can we get a message out that, there's opportunities to get vaccinated right now. And within one message being shared on social media, we've had people showing up to the clinic within an hour. So it's become this very interesting space where we're able to tap in directly to the public and give information in the most time sensitive way. And so I'm going to try to explain some of these things and how we've been able to leverage our social media channels to connect with our audiences. So we knew right away that social media was going to be a big part of MLHU's response to the pandemic. And for me, I have been tapped into my phone 24/7. I have read every comment. I have noticed every interaction. I've watched every video. And I feel like I've got this window into kind of the emotional state of our community and what people are feeling and what people are going through. And it's allowed us to kind of adjust our messaging and adjust our tone and shift the way we're saying things so that we can resonate with our audiences. And I wanted to take you kind of through a journey where there was some major, moments throughout the pandemic that we were all feeling kind of common feelings and having common experiences that allowed us to kind of shape our messaging so that it was resonating with people and the message could get out, the message could be shared, and people could talk about it and feel like it's speaking to them and understanding them. So just quickly, there's these key moments. So between March and April, things were just happening. There was shock, fear, uncertainty, togetherness. And you know what, Dan, let's just go to the next slide. This was just kind of a recap here. So I'm going to kind of go in a little bit more detail. So I'll never forget the moment when I realized it was happening. You watch all of these movies where the world is ending, and there's these moments where scientists are raising the alarms, and people aren't really understanding and not believing what's going on. And I had one of those moments. As Dan mentioned at the beginning of the presentation, there was travel advisories. If you're coming to Canada from Wuhan, you needed to do certain things. Then it was from mainland China. Then it was from Iran. Then it was from Italy. And then all of a sudden it was anybody returning from Canada, from anywhere in the world, including the United States, you had to self-isolate for 14 days. And we shared that message on a Saturday evening at about 6 p.m. and it blew up. It went totally viral. I think probably we've reached 500,000 people with this post. And it was a time when that information wasn't widely accessible online. So I had this moment where it was happening. It's happening right now. So that was kind of the first stage of this overwhelming feeling. Maybe the next slide there, Dan. And so then it happened. And then people realized, between March and April, there was a global pandemic that was impacting the entire world. It wasn't just about us, it was impacting everybody. Early on, there were bars and restaurants closed on St. Patrick's Day in March of 2020. And bars actually were kind of voluntarily closing to support the efforts. I remember at that time, there were bars that were doing their part because they knew how serious of a situation we were going through. And so they were closing. People didn't know what was open, what was closed. We were saying stay home, save lives. This concept of physical distance and not social distance became part of our understanding and part of our vocabulary because we were having to not be with our family. We were not being able to be with our friends, be with our moms or our brothers or sisters. And so it wasn't about being socially distanced. It was a clear distinction that no, we needed to be separated by physical distance. And during that time, there was a lot of togetherness. So our tone with our messaging was encouraging people. Keep going, stay strong. We're in this together. And kind of tapping into that common sense of togetherness. But it wasn't long before things changed. Cases started to drop, and for the most part, we beat the first wave. We flattened the curve, and things started to reopen. Businesses started to reopen, outlined by stages by the provincial government. gathering limits were permitted but limited. And then we started to wear masks, and that became the new normal. And there was a huge amount of adjustment that was going on in our community. So there was these feelings of a desire for going back to the way things were, you know, this desire for normalcy, and this adjustment to change, and also frustration, knowing that things are changing and we like the way that we lived before. We liked going into stores, not wearing masks, those types of things. So the tone of our messaging kind of touched into those feelings when things started to get worse again. It wasn't long before cases started to appear again, and things weren't very good. So, all of a sudden you've got businesses opening, we've got limits on people gathering, but for many people, things were going back to normal. So we kind of had to pull the brakes, and our messaging was around, it's not over. Don't let your guard down. COVID's still here. And it was the first time that we kind of had to remind people to be kind to each other, and that we're all experiencing this pandemic in different ways. And, everyone's experiencing the situation differently. And then things changed again. So the next kind of, shift in the tone and the feelings of what our community was going through was that, back to school was a big deal. August, July, we had a bit of relief. People could go outside, they could get back together. But then there was this preparation for getting back to school, getting back to our kids in elementary and secondary schools, students getting back into post-secondary education, getting back to, the world functioning. And this was a really interesting time as well. There was a concern for the future. There was an acceptance that we're not going back to normal. There was a new normal, and there was before the pandemic, and there was an after the pandemic. And so the tone of our messaging and the tone was about empathy and trying to understand where people are coming from, and that everybody's experiencing the pandemic differently. So acknowledging people's emotions and frustrations and challenging times. And, Beth showed that image of those cars lined up. And I'll never forget how difficult it was to get tested in those times, and how hard that was for families, for kids that required to be tested to go to school, and how much that impacted, the family dynamics and people being able to go to work, people being able to go to school. There was a lot of frustration and a lot of change that was happening at the time, and a lot of concern. So we were able to kind of adjust our tone to meet the feelings and emotions of what people were going through at that time. And then things changed again. It wasn't long before the world shut down again. People were tired. There was this term called COVID fatigue. People were just done. People had had enough. You couldn't tell them what to do anymore. You couldn't help them. There was this sense of, I can't do this anymore. This sense of hopelessness and confusion. So the tone of our messaging again changed, acknowledging the COVID fatigue and acknowledging that people had had enough, and encouraging people to do their best. Limit your contacts before going home. I remember students, cases were exploding. We had record-breaking case counts going into the holidays throughout the holiday season. And there was, this concern that students would be bringing COVID home to their families across Ontario. And so, doing your best to limit your contacts as much as possible. And also recognizing that at this point in the pandemic, people were really, really suffering. People's mental health and emotional well-being and mental well-being and overall well-being was really suffering. So just acknowledging, that you need to take care of yourself. And, I remember sharing messages like, turn off your phone, call your mom, do the simple things, take a break, go for a walk, do the things that you love and escape, the things that are causing you stress. So I remember that was another kind of a very significant moment, and things happened rapidly. We went from being and if you remember the COVID-19 response framework from the province, we went from this color-coded system. We went from yellow in November to orange and then to red in a week. And things were changing so rapidly, and the guidance was changing so rapidly that it was hard to keep to understand what was up and what was down, what we were supposed to do. Is it a social bubble? Was it not a social bubble? Was it, limit your contacts to your immediate household, or could you have 10 people in your household? It was very confusing, and it was very hard to keep track of, what type of guidance and what type of behavior people should be doing to limit the spread of COVID-19 and protect each other. And that was also the first time when variants of concern started to come into our community, which changed, again, the situation, the severity of the pandemic. So going into 2021, things started to get a little better. We had the vaccines. There was this new hope. There's coming from this COVID fatigue and exhaustion and confusion, there was some light at the end of the tunnel. Vaccine supply started to increase across Canada, and it was the first time where age groups could actually be eligible for the vaccine. So, there was this feelings of optimism, and we were able to adjust our tone to kind of get people ready to be ready to get the vaccine. So, our tone was around the end is near, and soon the vaccine will come and bring relief to all of the hardship that has occurred throughout our time in the pandemic. And again, things shifted really quickly again. It wasn't long before the province shut down again. I remember as a parent of school-age children, just on this slide, one more sec, Dan. There was this fake March break where the regularly scheduled March break was postponed. And then there was this, this idea among parents that, oh, we're never going back. That's what happened last time at the first wave. Well, guess what? Kids didn't go back to school, and things were very bad again. So it went from, things are good, here's the vaccine, to, back to urgency, back to emergency mode, back to, we need to do everything we can to stop the spread of COVID-19. So kind of moving on from February and April, we get into kind of more current times. And again, May to July, there was this rapid expansion of eligibility for the vaccine. We went from like age groups, 50 plus was eligible in May 6, and by May 23, pretty much anybody who was 12 plus was eligible to get the vaccine. So there was this rapid amount of communication that needed to happen around who was eligible for the vaccine and getting them their vaccine appointment and communicating all of this information as timely and as quickly as possible. And so during this time, there was this feelings of impatience. When is it going to be my turn? I want my vaccine now. But also then thankfulness that, we have the ability to this miracle, this science that's going to change the way that we respond to the pandemic. It's going to shape the way forward. So kind of using those feelings and tapping into those feelings and setting a tone of, letting people tell their own stories. This was a time when we were encouraging people to get the vaccine, but the best way to do that was to let people tell their own stories and to let people tell us why it was important for them to get the vaccine. And it was really not about us. It was more about what it means to you. And moving more into current times, I'm not sure yet. Right now, we're at a very unique situation in time as well, where we have reached pretty much everyone who wants to get vaccinated. You know, the province has called this the last mile. And we're trying to find unique ways to reach people where they are with pop-up clinics, you know, clinics downtown on Richmond Row. You know, you're seeing mandatory vaccination policies come into play, where we're encouraging workplaces to have a mandatory vaccine policy. Just this week, proof of vaccination requirements for certain business settings like restaurants and gyms are now required. So to get the last group of individuals in our community vaccinated is going to take different types of strategies. And so it's also creating a different sense of feelings and a different tone. And things are a bit ugly right now. There's violence, there's anger, there's frustration, there's feelings of anti-government. You can't control me. You can't tell me what to do. And so it's trying to understand and acknowledge those feelings and to not judge people for their feelings, and be there and openly and honestly answer their questions and do our best to give the factual information and kind of letting the facts speak for themselves. So that was kind of you know, my journey through the emotional roller coaster of the pandemic. And you might, you know, remember some of those feelings, and it's really kind of allowed us to, social media has really allowed us to kind of tap into the public's emotions and feelings and allowed us to shape our messaging. And that was something that I wanted to kind of outline, because that has played a key role for me and for our social media efforts in coming up with our messaging. I'm going to move forward now with kind of more, you know, some of the things we've done to create engagement, to be creative, and to, you know, encourage our audiences to share some of our messages. So we've used video to target certain populations and to tell a story. So early on in the pandemic, we on the right-hand side of your screen, you'll see kind of six squares there with faces. This was early on when individuals around 40 plus were eligible to get the vaccine. So we went to one of the clinics and we video interviewed some individuals and asked them why the vaccine was important to them and let them tell their story, which was pretty powerful, which encouraged people to get the vaccine that way. And then later on in the pandemic, or later on in the kind of the vaccine Olympics, as we've kind of, you know, coined it, we actually had an Olympic gold medalist, Alex Kopach, who was kind of an influencer in our community, tell our story as well. Alex Kopach was actually got COVID, got serious illness, and was hospitalized. And we were able to, you know, create a partnership with Alex and be a spokesperson for the vaccine to tell people who are younger, you know, you're not invincible. It can happen to me and it can happen to you. So we use those videos to kind of reach different types of audiences and use those channels to advertise and promote the vaccine. So moving on, Dan, we're also monitoring trends on social media, and to create engaging content and meaningful content. And for some random reason, sea shanties were a thing at one point. Yeah, random, but fun, really fun. So, you know, lots of people are musical at the MLHU, and it just, you know, it seemed like, you know, put two and two together. Hey, we know how to sing, we know how to play guitar. Let's do it. Let's do a sea shanty. And the next thing you know, we've recorded the sea shanty, and you know, it's got thousands of views and you know, hundreds of shares and likes, and we've got media attention about it. And so it's a good way to kind of, you know, show our playful side, but also get a message out about the vaccine. And then also, you might remember the Bernie meme, Bernie Sanders meme, when Joe Biden was inaugurated as the president of the United States. Bernie Sanders attended the inauguration in a coat and cute mittens, and that meme went viral. And so we shared that. We put Bernie in front of our MLHU offices, and we had him monitoring the door, asking people to wear their masks before they entered our building. Moving on, you know, we created traffic light graphics to help kind of guide people on the behaviors they should be taking. Is it safe? Is it unsafe? What to avoid? When to use caution? What's safe? And what I kind of alluded to, in some of the past slides, was how confusing some of the information was. And I'm sure people watching have had conversation with their friends, with their families on, how confusing it was. What should I do? People just want to know what to do. What is safe? What is not safe? And it's not that easy. There's a lot of gray area, and people have to make decisions for themselves. And there's not really a right or a wrong. There's a least safe and there's a safer option. So these traffic light graphics helped us communicate kind of the spectrum of guidance and behaviors that we encourage people to take, so that they could protect themselves and their loved ones from COVID-19. So that is something that we've kind of used throughout the pandemic to help guide people and help people make their own decisions about what they feel comfortable doing in a safe way. So moving on from that, we've also been celebrating milestones and key achievements, and the vaccine effort has been one that we've been doing as well. So we've been celebrating the progress of our vaccination campaign throughout the pandemic, and most recently we've celebrated 750,000 doses of vaccine provided in Middlesex, London. That is just an unimaginable achievement. The amount of effort and the amount of partnership and the amount of collaboration that it takes to vaccinate and to provide that many doses of vaccine, it's totally, it's a remarkable achievement. And to have 85%, above 85% of our population now with a first dose of the vaccine, it is again a remarkable achievement, and we are well on our way to getting people as protected and as possible in our community with the vaccine. So moving on with that, again, using social media to expand and expand and amplify the messages that we're sharing across MLHU, whether it's proof of vaccination, on how to get your vaccine receipt, where can I use my vaccine? When do I have to use my vaccination receipt? What type of proof do I have to show? What type of ID do I have to show? And then down to getting a message out about a public exposure risk at bars. There was recently someone who attended a bar who was symptomatic, who tested positive for COVID-19, and there was a risk to people who were at that bar. So using social media to get that word out, so that people would be made aware of the potential risks they would be having if they attended that location. And there's many examples of that throughout the pandemic. Again, supporting local and other public health partners and other health partners and sharing their messages. So whether it be other public health units, the City of London, LHSC, Middlesex County, Middlesex-London paramedics, the library, we have so many different partners and so many different messages that are relevant to the MLHU's messages, that sharing those messages are very important. Responding to questions and comments on social media. This has been a challenge, to say the least. Our capacity was pretty much gone from the beginning of the pandemic to be able to actually thoroughly respond to questions appropriately and address every comment and concern. But being tapped into social media, you get to weigh the ones that are worthy of comments and responses versus ones that can be taken care of by automatic responses that direct people to our website or to our health line or to our key resources. So just being in touch with when a comment is worthy or when a question is worthy of a more public response, so that people seeing those comments and seeing those questions could have an official response from the Middlesex-London Health Unit to help them, guide them, and understand the information in the best way possible. So moving on from that, and again, having some fun, kind of doing things a little bit differently to kind of stand out on social media. There was times when, it was hard to reach students with information about the risks of partying. So we thought, what better way to do that than be silly and to create a graphic that looks terrible? So we drew this house party on Microsoft Paint, and we were kind of inspired by Ottawa Public Health being cheeky and being silly and being obviously, over the top stupid, to kind of grab people's attention. So there you can see COVID walking into the house party with a case of beer. You can see people funneling beers and doing keg stands, and there's COVID coming into your party. So, and then we also drew our logo, which I thought was fun. You don't often get to draw a logo of your organization in Microsoft Paint for a specific purpose. Participating in Star Wars Day, a devastating virus has taken over the galaxy. Public health forces have been fighting the evil coronavirus for over a year. But the defensive measures have weakened the enemy's forces, but it's building its secret weapon, the variants of concern. So, tapping into Star Wars Day to get a message out about how serious the variants of concern are, and the urgency of, what we need to do at that point in time. So moving on from that, we've also more recently gone on to Instagram Live to not be afraid of the trolls, and to answer comments and questions openly, and to put ourselves out there on social media. When you start an Instagram Live session, you never really know what's going to happen. You have no control. You can't control the conversation in the comment threads. So, this was one way to address, later on in the pandemic where many people have been vaccinated, how do we reach those people that are not sure? How do we reach those people who are on the fence and just need to speak to someone to answer their questions in the best way possible? So we really put ourselves out there on Instagram Live to answer those questions. And we were very fortunate to have partners at LHSC. Dr. Rod Lim joined us for a session about kids and getting the vaccine. And Dr. Rod Lim's a pediatric physician at LHEC. And then we also had a session with Dr. Carol King. And my apologies, I'm forgetting the name of the other physician about
Taryn Taylor, Dr.
Yes,
Taryn Taylor.
Yes, thank you. Providing information and answering questions about fertility and pregnancy, and what does the vaccine mean for those folks. And then we also had a session with Alex Kopach to talk about his experience in getting COVID-19, and how he experienced that, and talking about the vaccine and what it means. So moving on from that, we've also again had our pop-up clinics are really targeting people where they are. It's not so much having people come to vaccination clinics, but going to places where we know people are. And one of those spaces was on Richmond Row, trying to target people who are younger, the younger groups. So we know people are going out, having drinks, having dinners, meeting up with friends. So we came up with this idea of doses after dark, and so going out for a drink, we're bringing our sexy vax, kind of playing on Justin Timberlake's sexy back. So that kind of idea of reaching people where they are, in a location that where they are, and it's easiest as possible to get vaccinated. And where appropriate, we're using humor. And the one on my left is my personal favorite as a father of a 7-year-old and a 4-year-old. Giving your mom, the mother, the physical distance she deserves on Mother's Day, kicking the son and the family out into the cold, so that mom can enjoy a quiet cup of coffee by herself. And more recently, partnering with the Forest City Sport and Social Club on getting vaccinated to play sports. So do it for sport, get vaccinated for the love of sport. So you see there a guy getting smoked in the face by a dodgeball. So, partnering with them to do a photo contest on getting vaccinated. And if you shared your vaccination sticker on social media and tagged us, you got money that could go towards a team registration with the Forest City Sport and Social Club. Moving on from that looks like it's the end of my slide. So that's kind of a snapshot of MLHU's social media efforts to expand the reach and the ability of sharing important messages throughout the pandemic, and how we kind of use social media to reach our audiences in an engaging and meaningful way.
Thanks very much, Alex. And an awful lot of, it was funny as you went through the slides, it brought a lot of memories back to the fore. So thank you very much for sharing that, but also that experience that that you lived through. And I think you described very well some of the feelings that we've had all along, not just within our team, but I'm sure for the people who are watching as well. I'm just going to quickly, for Robert and Megan and Jay and Michelle, we're just about wrapped, so I do want to have an opportunity for questions. I just wanted to mention just a couple of quick things. You know, again, reaching out and supporting the effort. One of the things Alex talked about was, you know, having that proportion of the population who now have at least a first dose at more than 85%. At the time we created this resource, it was about 80%. And again, this is something we created that has gone door to door in the postal codes in London and Middlesex County where the vaccination rates are lower, and reaching out to people and trying to encourage them to come back along. Vaccination means getting back to what we've missed. And on the back of this resource was a message, you know, encouraging people to get vaccinated and to get the facts to help them make a decision, but also for people who are within those postal codes who had been vaccinated, just encouraging them to talk to friends and neighbors about the reasons why getting vaccinated was important. And again, picking up on something Alex was talking about before, getting people to share their stories about vaccination. So I just want to wrap up with, you know, the pandemic really has been the sole focus of our communications team for the last, well, more than 19 months. In many ways, it's been an experience that will continue to shape not only our professional lives, but our personal lives as well. And while we've covered a lot of ground since January of 2020, we have not reached the end of the journey, not by a long shot. The experience has been a challenge, and at times it's been exhausting, but also exciting and invigorating. We will continue to support the health unit as a communications team in its efforts to meet the challenges of COVID-19, and we will do our best to encourage and support each other as members of our communications team as we strive to do so. Thank you for your attention. I know we've gone over time a little bit, and hopefully there are some folks who have some questions. We'd be more than happy to take those. So I will turn it back to Jay and Michelle, and if there are questions, we'll happily take them.
Thank you so much. That was a wonderful and thorough presentation. And I just wanted to say on behalf of everyone attending here, thank you. Thank you for your work that you've done over the past 18 months. We've all been following it, and I'm sure it was very stressful at times, but it was wonderful what you guys have done for the community. So thank you. I do have a question already here. So for anyone attending or participating, if you have a question, pop it in the Q&A. With that said, I am going to be cautious of the time, so we'll only go through a few questions tonight. So the first one is from Dev. During the pandemic, being a healthcare communicator and public relations professional, what are the different strategies employed to ensure that the communication to the public is truthful, honest, but also does not create panic and uncertainty? I'm
sort of glancing at Alex and Beth on screen. I'm happy to jump in, and if you guys want to add anything. You know, I think it's important to point out that, as I mentioned before, the relationships that we have forged with the media and with our partners go way previous to the pandemic. And we have always, and this is something that's very important to me, and Alex and Beth will, you know, this is a mantra that we talk about all the time. We want to be as open and as transparent and as forthcoming as we can possibly be. If we're going to have a bad day, if it's something that's you know, a challenge to report, well, we're going to have a very bad day, but we're going to get it all out so that that message can be shared. And I think we're very, very fortunate to have in our leaders people who share that that value. You know, if we think before the pandemic, if we think back to all the effort about supervised consumption facilities and now consumption and treatment services for injectable drugs. I mean, we weren't hiding anything. If we're able to share it, we can. And, you know, earlier in the pandemic, we had a challenge when there was a death that was reported in a young person. And, you know, we had to be as open as we could be about that situation. And, you know, if we're able to share it, and the line for us really gets drawn at when it comes to sharing personally identifiable information, that's a line we don't cross, but we get pretty close to it sometimes. We really do try to share the information as much as we can. Beth, Alex, anything to add on that?
Yeah, something that's been, you know, on my mind through the course of this presentation also in terms of, you know, being truthful and honest is, and speaking to a group of communicators, I just really want to acknowledge that we don't always get it right either. You know, here we are with a presentation of our journey through the last 18 months, but it hasn't been perfect and we've made mistakes, and we've, you know, if whether it's a graphic or an error in a media release or a statement, you know, we've made mistakes, and we all do. We're all human, and as communicators, we're going to make those mistakes. And I just want to throw it out there to a bunch of like-minded colleagues. And I think the key in being truthful and honest is owning up to those mistakes publicly. And, you know, where we've needed to do that, we'll issue a tweet. Where we've announced a doses in the dark and something's come up due to scheduling, we acknowledge it. We apologize to the folks that were planning to attend. We don't hide behind any of it. We do all value, you know, open, honest, and transparent communication. And I think that that's something that, you know, Dan, Alex, and I guide our own personal values. So that's been really important as well, is just acknowledging our mistakes and telling the public that we've made a mistake and we're sorry, and continuing to move on from there as well.
Yeah, that's great. Thank you. Thank you for the question.
I might just quickly jump in and just add, I feel like social media can help with that. You know, it is a space to be more personal. It is a space to be, you know, kind of let your guard down and be less formal and kind of try to relate to people. So I feel like some of our live Q&As on Instagram have made an effort to be open and be there to answer the questions no matter what they are, and to not kind of shy away from different types of opinions about the vaccine and about the pandemic. So I feel like, you know, the social media space is a space to kind of listen to people and understand what people are going through.
Absolutely. Thank you. Dan, sorry, did you have one more thing to add?
No, I was just going to say, boy, Instagram Live is a wake-up call. If you haven't done one of those, you know, taking the questions is one thing, watching the comments fly by is another. And you just, there were a few that I remember when we did the one with Dr. Lim and Dr. Summers, and I'm you know, moderating the discussion and leading that, and seeing some of the comments that are coming up, and I'm going, somebody please comment, throw something else in, so that's going to disappear, because there were a few of them that were just outrageous, you know, and you're sort of looking at it and going, I'm not even going to acknowledge that. Let's just go to the questions. So that was exciting.
Well, actually, that's a great segue to our next question, and this will be the final question. It's from Leo. So again, thanking you guys for a wonderful presentation. One challenge with responses from the community that are in opposition to the message you shared, or a negative tone, what was the approach to connect with those members? Any advice for how communicators can strategize to communicate would be great.
Whew, wow. I'm going to gather my thoughts for a second, because there's something that I'd like to bring up that is a fairly recent thing. But Alex, Beth, do you guys want to jump in?
Yeah, I mean, you kind of have to, I'm trying to think about an example to kind of help me answer the question. And I think that one kind of example sticks out is, you know, we recently announced our first case of a COVID-19 case in a school, and more recently, a first case of a COVID-19 outbreak in a school. And we shared a media release for this school term for the first case and for the first outbreak. And in that media release, we stated that this will be the only media release that we do that, And moving forward, all cases will be reported on our dashboard. And so that message was met with criticism. You know, the public wants to see every case be a media release. The public wants to see every outbreak to be a media release and on social media. And, you know, that's not the way that we were prepared to share that information. You know, we've talked about it many times throughout the pandemic, but our daily dashboard is on our website. It's updated every day, Monday to Sunday, every day at 12 p.m. The media knows where to find that information. The public knows where to find that information. We're holding media briefings twice per week where the media can ask questions, anything about the COVID-19 pandemic, including school-related information. And then, you know, outlining the process of what happens when there is a case in a school. You know, it's not like people don't know about it. If it's going to impact you personally, you're definitely going to know about it. So just, you know, answering that type of question and giving them the facts, you know, to be able to address that concern so that people didn't think that we were hiding something or that, you know, we were trying to hide that schools aren't safe. Because, you know, that message, people could kind of jump to conclusions and go, oh, they're hiding something. They're not putting a media release out because of a case in a school. And so that type of comment came up on social media. And again, that was one where we flagged and said, you know what, we need to address this one. So I feel like that using that specific example kind of helps me answer that question.
You know, there's the whole spectrum of comments that we receive. We get everything from, why aren't you guys recommending hydroxychloroquine, to, you know, great job. Love the social media stuff. When Alex showed the intern drawing that was done in paint, we had all kinds of people just laughing and having fun. One of the things we didn't talk about was we did a rap, a COVID rap thing where we were changing lyrics in rap songs, and it was a challenge with other health units and public health departments in the States. There was just a lot of fun. But we also get people who are just, and more recently, and Alex spoke to the tone of this, more recently, we're seeing people who are very upset and taking things into their own hands. So there's also a little bit of that measuring the tone, measuring the intent, measuring, you know, what's involved. And recently we had a post on social media that was threatening. And we had to take that threat seriously because, again, you know, when you see what's happening in other parts of the country, you see what's happening in other parts of the world, you know, err on the side of caution. So be on top of what's being said about you and have the resources dedicated to that. This is what Alex does. And this is why he is so good at what he does, is because he's in tune with the tone, with the message, with the things that are going on in the community, so that when the comments come up, there's context. I think if you are not on top of it, if you are not aware of it all the time, that there's the potential that you're going to miss something or misinterpret something that could have big implications for your overall communications efforts and goals. Beth, did you want to add anything there?
No, I think you guys covered it really well.
Okay.
Absolutely, and you guys do fantastic work. And I will just say, I feel for the negative comments that you get, but if you look in the chat, there's a lot of love going around. Thank you for keeping us safe. Thank you for this presentation. I'm just highlighting a few of these messages. We are so grateful that you guys are here tonight. And also for the work that you do. So thank you so much. And thank you for everyone who came out tonight to listen to this presentation. It means a lot. Before we end, I am just gonna put a plug in for in October. If you are interested in learning how to make your communications less boring, on October 21st, which is a Thursday, we'll be having Kieran Flanagan all the way from Australia to come teach us how to make your message stand out. So thank you everyone for attending and have a wonderful evening.
Thanks. See you later.
Thank you, folks.
Thank you.